in this video we are talking about our vertebral column. Now let's look at it posteriorly. Can you notice that we have these bumps all the way in the back? And we feel these bumps in our back. Try passing your fingers in the middle of your back. These are named spinous process. Let me show you in this one. This is specifically this one. So this is a spinous process. With that in mind, you can conclude that the spinous process has to be posterior because you can feel your spinous process. And at the same time, you can conclude that this part of each vertebra needs to be anterior, like you're seeing here. So the spinous process is posterior, and this part of the vertebra, all this, which is the same thing as this, is anterior. This is the body of the vertebra, and the body is also named centrum for a reason, because it is closer to the center of the body, right? Okay, awesome. Now, this right here is a hole in a vertebra, and we know that a hole is named foramen. Consequently, a hole in a vertebra is named vertebroforamen. Amazing. Now, I need you to pass the finger in the middle of your back like this, from up down. And now I need you to do it from bottom up. Do you feel a difference? Yes, you feel a difference. Why? Because our spinous processes are always pointing down. So it's much smoother when you go from up down, and is rough when you go from bottom up. And that's how you do to remember that the spinous process is always posterior and pointing inferiorly. And that is crucial for you to remember that this is then the superior aspect of this vertebra, and this right here is the inferior aspect of this vertebra. So every time you grab a vertebra, the first thing you do is you identify the spinous process and you make sure it is pointing down, because all spinous processes are posterior pointing inferiorly. With that in mind, you grab your vertebra, you hold the spinous process, and you see that you have right here, close to the inferior aspect of this vertebra, these facets. And when you look right here, you have facets as well. But since you know that the spinous process is posterior pointing inferiorly, you can conclude that these facets are in the superior aspect of this vertebra, and these facets are in the inferior aspect of this vertebra. And these facets are articular facets. And if we articulate this vertebra with another vertebra like this, you see? You can clearly see that the facets in the superior aspect of this vertebra are articulating with the facets in the inferior aspect of the vertebra that's above it. And these are articular facets. Consequently, if we name them according to their position, we have the specific name. These are superior articular facets, and right here you have the inferior articular facets, okay? Now the superior articular facets of this vertebra right here are articulating with the inferior articular facets of the vertebra that is right above it. Now you can see that there is a space between the bodies of these two vertebrae, and in this space we have an intervertebral disc. So this is the intervertebral disc between bodies of different vertebrae. Awesome. Now, using this model, you can see that this is one vertebra, this is another vertebra, and right here, we have a space between the two vertebrae. Passing through that space, we have a spinal nerve. And when we look here, you see, right here. And that is a space between two vertebrae, and the root for between is inter. Consequently, this space right here, this space right here, is what we call intervertebral foramen. It's a hole between two vertebrae. And passing through the intervertebral foramen, we have spinal nerves. When we look at the vertebral foramen, which is the hole that we have in the vertebra right here, when we line them all up, we have the vertebral canal, and passing through the vertebral canal, we have the spinal cord. You see, and then the spinal cord ends, and we have the cauda equina that we are talking more when we cover the nervous system. Now, that's the basics that you need to know about vertebrae. The vertebra I was showing you is specifically a thoracic vertebra. Now, I can only tell you it is a thoracic vertebra because each vertebra has specific characteristics associated with it. The thoracic vertebrae are the vertebrae that will have ribs clicking on it. Okay? So you have 12 thoracic vertebrae, and in each side of them you have ribs associated with them. When you look at the cervical vertebrae, you do not see ribs associated with them, and you also don't see in the lumbar vertebrae. So when we have bones clicking, that will make a little indentation. And when I look at a vertebra and I see an indentation that is caused by the ribs clicking on it, I know that will have to be a thoracic vertebra. And what I'm talking about are these indentations right here in the body of this vertebra. You see, this is one indentation, and here is another indentation. If you look at the body of the cervical vertebrae or lumbar vertebrae, you don't see any indentations like that. Consequently, when I see indentations in the body of the vertebra, I already know that is a thoracic vertebra. Now, we have 12 thoracic vertebrae, we have 7 cervical vertebrae, and we have 5 lumbar. And the way I suggest you to remember is by saying 7 cervical, 7 cervical, and then you say 12 thoracic. Very funny, both with TH, okay? 12 thoracic, and then you go 7 minus 12, 5 lumbar, and that's it. So you have 7 cervical, 12 thoracic, and 5 lumbar. Now, guys, if we have 12 thoracic vertebrae, you can conclude that we have 12 pairs of ribs, right? And when we look at the ribs, what we see is that each rib has a head, and then if you have a head, you have a neck, and then you have this bumpy structure, which is a tubercle, okay? And when we look at how the ribs are clicking into the vertebra, what we see is that the head of the rib touches the body of the vertebra right there, and that's what creates that indentation. And then the tubercle of the rib touches this part of the vertebra. Now, this part of the vertebra is something that sticks out, and something that sticks out is a process. And a process that is in a horizontal direction is conveniently named transverse process, okay? So these are the transverse process of this specific thoracic vertebra. So what we see is that the tubercle of the rib touches the transverse process of the vertebra right there. And then when that happens, we have an indentation in the transverse process. Now, rib in anatomy is referred as costal. So every part that we see an indentation in a vertebra that is caused by a rib touching, we need to add the word costal in it. So this one is caused by the head of the rib, and it is in the superior aspect. This indentation right here is called superior costal facet. This indentation is caused by the head of a rib, but it is in the inferior aspect of this vertebra. Consequently, this is named inferior costal facet. And this indentation right here in the transverse process that is caused by the tubercle articulating with the transverse process. This indentation right here, this flat spot right there, is named transverse costal facet, okay? Now, we have different ribs in our body, and they are named vertebrosternal ribs, the first 7, and then you have 3 vertebrochondral ribs, and then you have 2 vertebral ribs. Guys, the names makes sense, okay? Look at this. These are called the first 7. You remember, 7 cervical. The same number as you have for cervical vertebrae is the number that you have for the first 7 ribs. So you have 7 cervical, 7 first ribs. And these first 7 ribs are the vertebrosternal ribs. Why? Because they go from the vertebrae, or from each vertebra right here, to the sternum, vertebrosternal ribs. Now, after the first 7, we have these 3, and these 3 are named vertebrochondral, and chondral means cartilage. And these 3 are the ones that they attach to a piece of cartilage that attach to the other cartilage that goes towards the sternum. So these 3 pairs of ribs, they have an extra piece of cartilage before they attach the sternum. Consequently, they are named vertebral. They go from the vertebra, chondral, to the extra piece of cartilage. With that in mind, I will show you now 2 ribs that they just attach to the vertebra right here. How do you believe these ribs are named? They are just called vertebral ribs because they just have the point of attachment that is towards the thoracic vertebrae right here. And these are the last 2. These last 2, since they do not attach to any cartilage that will attach the sternum, when you look at their ends, you see that they have this pointy end, okay? The pointy end is not a good surface for cartilage to come and attach to it. So these are vertebral ribs, okay? In this direction. So these are the vertebral ribs. This is the pointy end. When you compare this end to this end, you can see that it's completely different. This end of the rib has a surface area that is very good to attach to cartilage. So when you see this end, you already know that this is not, it cannot be a vertebral rib. It needs to be either a vertebrochondral, which has the extra piece of cartilage, or just the vertebrosternal ribs. Because as you can see here, the vertebrosternal also have this little attachment of cartilage before they go and have this connection with the sternum. Now, when we look at the ribs right here, how would we be able to identify if it is vertebrosternal or vertebrochondral? And the best way to identify is by looking at them in a table. Because if you touch your ribs right here, guys, you would feel that they are more standing like this. And as you go up, they are more like this. So when you place ribs in a table, you would be able to see that if they are completely standing like this, they would be vertebrochondral ribs. And if they are more in a horizontal way or like in a transitional way, they would be the vertebrosternal ribs. Now let's take a look at what makes the cervical vertebrae very distinct from the thoracic and lumbar vertebrae. The cervical vertebrae, they are characterized by having a hole in the transverse process. So a transverse process is a bony part that sticks out, and transverse tells you that it's in a horizontal way. And when we look at the transverse process of the cervical vertebrae, we see holes. How do we call holes in anatomy? Foramen. So these are named transverse foramen. They are holes in the transverse process. The only vertebrae that have the transverse foramen are the cervical vertebrae. And they are used, these holes are used for the passageway of arteries and veins. So this is how you do to identify very quickly cervical vertebrae. Also, the cervical vertebrae are the only ones that have the spinous process. Remember, this is the spinous process. Bifid. Bifid is like cutting into two, like a bicycle has two wheels. So bifid is cut into two. So this is a bifid spinous process, and you have even more pronounced bifid spinous process depending on the cervical vertebrae you are analyzing. Also, cervical vertebrae will have the body, right? The body, the vertebral foramen, the big hole in the middle of a vertebra. Do you remember the other name for body? Centrum, right? Because it is closer to the center of the body right here. The spinous processes are always posterior. Awesome. Now, when we look at two cervical vertebrae articulating, we would have the same arrangement, guys. All vertebrae, they will articulate and they form the vertebral canal. So when you grab a cervical vertebrae, you always identify the spinous process. You know it needs to be posterior and pointing down. And now you know that this would be the superior part of this vertebra, and this is the inferior part of the same vertebra. And these are right here the articular facets. Consequently, these are the superior articular facets, because this is the superior side. Look, this is the spinous process pointing down. And right here, you have the inferior articular facets, because it is in the inferior aspect of this specific cervical vertebrae. Now, the cervical vertebrae also have two very special vertebrae in the group, and they are the atlas and the axis. Atlas is the C1, the first cervical vertebrae, right here. So the atlas is the one that will articulate with the occipital bone. And when we look at the atlas, what we see is that the atlas does not have a body. It's the only vertebra that does not have a body. And besides not having a body, the atlas is the only vertebra that does not have a spinous process. That makes the atlas very exclusive. Now, the atlas is the one articulating with the occipital bone. Our head looks like a globe, like an atlas, and that's why you can easily remember that C1 can be also named atlas. When we look at C2, which is the second cervical vertebrae, it goes like this. You see? That's how they articulate. Consequently, you can see that this part right here is in the superior aspect of C1, the atlas, and this is what we articulate with the occipital bone, specifically the occipital condyle of the occipital bone. And when we look in the inferior aspect of C1, we have the inferior articular facets of C1, which is what we will see articulating with the superior articular facets of C2. These are the superior articular facets of C2. Now, look at this bumpy thingy here, this little ball. You know what this is? This was the body of C1 that got fused with C2 during embryonic development. And then it became this odontoid process that we call dens. So C2, the second cervical vertebrae, has also very specific features. And this is the dens of C2. The dens of C2 articulates with C1, the atlas, like that. The other name for C2 is axis. Why? Because when you put them together, C1 and C2 together, guess what can happen? You can rotate in an axis. That's why C2 was named axis, and now you know it all. C2 has a spinous process because the only vertebra that does not have a spinous process is C1, and C2 has the body of C1 right here, which is the dens. So again, C1 does not have a body and does not have a spinous process. Now, the only thing we are missing to look at is the lumbar vertebrae. There is nothing very special about the lumbar vertebrae, with the exception that they're very big and very robust. This is the body, and you see it's very big. Obviously, they need to have a very big body because they're all the way down right here in the vertebral column, and they are the ones that need to support the majority of our weight when you look at the vertebral column, right? So, since the lumbar vertebrae do not have holes in the spinous process, they have just a regular spinous process. The lumbar vertebrae, they do not click with ribs. There will be no indentations in the body of the lumbar vertebrae or in the transverse process of the vertebrae. We can only say that they have like this bigger body, and that's what will help us to identify them. Now, the only bone missing is the sternum, which is the easiest bone in the whole body to remember the parts, because look at this. This is the sternum. The top part, it looks like you can see the letter M. That makes you recall that this is the manubrium. This is the body. And this, it looks like you have a letter X right here. So this is the xiphoid process of the sternum. And there you have it. Manubrium, body, and xiphoid process. Please let me know in the comments if you found this video helpful. See you in the next video. Bye!